In today's episode, we're going to talk about Obamacare, Trumpcare, I don't care, all about your health care. Let's go.
Welcome to the What Up Doc University podcast, your number one resource for total body wellness. Here's your host, Dr. Mike.
All right, so another episode. This is Dr. Mike Okuchi, coming from the What Up Doc University podcast and Velocity Wellness Center. If this is the first time you're listening to this, welcome. Today's going to be an interesting episode. It's going to be kind of a rant from me. Some of the things that I've been seeing through social media feeds. I rarely turn on the news. I get my fake news, I guess, from social media. But from what I've been seeing popping up, there's a whole debate, going around because of the changes in Obamacare, and then what Trump is putting into play, Trumpcare, and all this debacle around healthcare, which is rightfully so. Your health is your number one asset, and people, slowly understand that without your health, you can't do anything. And the access to proper healthcare is very, very important. So don't get me wrong. I truly believe that, we need access to healthcare. Now, the problem becomes of how this is being instituted and the subtle marketing around it all. And what I mean by this is that we are painting a picture in society today that, especially with what rolled out with Obamacare, and painting this picture of what is preventative medicine and how people qualify for different levels of health benefits and all of this stuff, and I'm just going off of what I've seen, through patients coming in the office and what they show me with their health benefits, and how I've seen the healthcare arena change. Just over the last 6 to 7 years. So to put it into perspective, pre-2008, what I saw was that we had, or patients had, lower deductibles, and their payouts and their benefits were much higher, meaning that as practitioners, we were reimbursed higher. And then over the years, post 2008, we saw reimbursement starting to decrease, and then deductibles starting to increase. And so what that meant was more out-of-pocket expenses for patients. Now, Obamacare started to roll out, which I looked at, and in all honesty, I was in favor of, mainly because of, one, more access to insurance coverage for those that were denied previously, people who didn't have or couldn't afford insurance coverage, and then the one thing that I got excited about was, well, they're going to start covering preventative measures, and that was, for myself, who practices a lot of prevention, it was eye-opening. I was like, oh my gosh! So finally, this establishment is opening their eyes. And then when I started reading the provisions behind it, I started to see certain things that I'm like, this is not really preventative, and the things that are truly preventative are not even on this list, right? So if we look at what were some of the things that were considered preventative measures, they are actually reactionary measures. So, hey, here's an example. One of the things that was covered by these plans of the Affordable Healthcare Act is mammograms for women. And I totally didn't understand why that is considered preventative, okay? So a mammogram, for those of you guys who have no idea, is looking for breast cancer. So you're basically putting the breast into these two plates and you're squishing it and then radiating it to see if there are tumors. Now, it's a positive finding if there are tumors in there. How the heck is that preventative? That's like you going into, you are a fireman and you are going into a house that's already burnt down and you're walking around in the ashes, and then you tell the homeowner, hey, guess what? You have a fire in your house. It's like, yeah, no duh, right? That's what we're doing with stuff like mammograms. Other things are like pap smears, okay? And they're looking for cancerous cells and HPV and all of this kind of stuff. Well, that's still reactionary. And I hate to tell you guys this, most of the things that's in the healthcare arena are all reactionary. Now, other things that are truly preventative, which in my opinion should be covered, which is like diet, right? Because if you look at the majority of all of these chronic health issues, they all stem from diet and lifestyle. So why aren't we giving provisions for diet? It always baffled me that eating a healthier lifestyle costs more than a non-healthy lifestyle. That's where the money should be going, guys. The money should be going towards, hey, let's actually give you an incentive to eat fresh fruits and vegetables that are not laden with pesticides, herbicides, insecticides, and GMOs, and all this fake food stuff. That's truly preventative medicine right there. Let's give and allocate the money and give that to underserved populations. Let's give them the knowledge and the access to fresh fruits and vegetables, and teaching them how to eat, how to live a healthy lifestyle. Let's stop putting these convenience stores and liquor marts on every single corner. Let's stop pumping kids in elementary schools full of sugar. That's truly preventative. Now, we've had a change in command, right? Many of us are very aware of that. We got a new president, President Trump. And I've seen his outlines. Nothing's changed. So, what am I telling you guys here? What? And this is, I see a lot of people waste their breath on this, arguing, my president is better than your president. I'm a red state. I'm a blue state. I'm an independent. I'm whatever. Guys, the truth of the matter is, they're not going to take care of your health. They're just not. You have to stop relying on the government, on whatever new president that you feel is, gonna be the best thing, or that you attach to. Throw that all out the window, guys. You need to take this into your own hands. No insurance policy will take care of your health. Only you will. And it's pretty basic, right? Eat a sensible diet. Don't get all caught up in the minutia of, well, I need to be on this type of diet. I need to be on a South Beach. I need to do keto. I need to do paleo, whatever. Eat a sensible diet. A lot of people, they get caught up in the minutia of all these diets. And what happens is, if they don't see the results, which, by the way, they're measuring in the wrong way. You can't use the scale and measure your health. You gotta just eat a sensible diet, and then, lead a healthy lifestyle. You gotta get movement. You gotta get sunshine. You gotta get air. Drink good water. Have, great social relationships. Decrease the unneeded stress. And then have, and with the stress, guys, you gotta take perspective, right? Is it worth stressing out about? Look at the bigger picture. At the end of it all, like Les Brown, one of my favorite motivational speakers, Les Brown always says, we're not going to get out of life alive. Nobody's going to get out alive. So enjoy it while it lasts. Okay? So don't get all wrapped up in politics and arguing about the healthcare and all that kind of stuff. Take it into your own hands. Be responsible for your own health, because at the end of the day, these preventative measures are still reactionary. And you look at all the studies, guys. Even the World Health Organization says that 9 out of the 10 leading causes of death that we're currently experiencing are all preventable. The more surprising thing is that they said that even though we know that it's preventable, over 80% of the people will not take the measures to prevent those things. Like they said, people know that smoking leads to lung cancer, yet 80% of the people who smoke chronically will not get rid of it, will not stop. And these are the kinds of things that is truly preventative. You need to take your health seriously, and you need to take it into your own hands. That's the whole reason why we do this podcast, is to give you guys the information and disseminate the information and strip it down and make it easily digestible and understandable so that you can take action without getting confused, without bumping into or tying into fad diets and fad exercises. Look, our ancestors in the hunter-gatherer era, they relied on primarily fruits and vegetables, and occasionally they had meat. They drank water. They lived in a very simple lifestyle. They walked a lot. Every now and then they ran. Right? Take that approach, guys. It's very simple. Look at nature and live according to that. Right? There's more vegetation on this planet than there are animal life. So the majority of your diet should be plant-based, and then putting in some animal products sparingly. Right? It's a very, very easy thing to do. We can't overindulge in things. Am I saying that you should never, ever have a cake or a hot dog or whatever? No. You're still living in modern day society. You can have that every now and then, but that shouldn't be the norm. Right? Don't become a statistic of modern day lifestyle and then have to rely on the healthcare arena to take care of the things that you could have prevented. Now, with that said, our modern day healthcare arena is not supposed to take care of the preventable things. That's the conundrum that we're in. It's not meant to be that. Our modern day healthcare arena is designed for emergent care. It's designed that if you're having a heart attack, we have the best doctors in the world to take care of that. If you have a brain hemorrhage, we have the best doctors in the world. If you get into an accident that you got your arm lacerated, we have the best doctors in the world to take care of that. I mean, I saw a study where they were talking about taking off some guy's head from his body and putting it onto another person's body. That is phenomenal, and that is plausible. That's what our healthcare arena is designed for. It's not designed for, hey, I have high blood pressure, or I have high cholesterol, or I'm overweight, I have XYZ chronic disease. It's not designed for that. Medications only treat the symptoms, but it never gets down to the underlying cause. And more so, the bad things that we tend to overlook is that the medications will actually cover up the underlying cause, because we're not allowing the symptoms to prevail here. It's kind of like me, again, the fireman analogy, me running into your house with the fire going off and the fire alarm's ringing, and all I do is I turn off the fire alarm and I walk out of your house and I say, problem solved. The alarm's no longer ringing, but your house is burning down slowly and slowly. That's what's going on today, guys. So let's prevent the fire. Let's prevent the fire from even starting in the first place. So I hope this was a little educational, a little eye-opening. Hopefully you guys can take that into account and really realize that Obamacare, Trumpcare, all of that stuff, nobody really cares about your health, but you should. So with that said, it's Dr. Mike from What Up Doc University Podcast and Velocity Wellness Center signing off again. Until we meet again, be well and aloha.